Hello, my name is Rachel and I'm a nurse practitioner student. Today I'll be doing an exam of your eyes, ears, nose, throat, and neck. So this video is for education purposes. So I'll be saying a lot of things as I'm assessing and inspecting out loud that you normally would not hear. I have reviewed, I'm actually going to wash my hands quick. And I closed the door to give us some privacy. I've reviewed the vitals that the nurse has obtained. Your blood pressure was 118/70, heart rate is 72, your respirations are 16, and your temperature is 98.4. Your height is 5'8", your weight is 180 pounds, which your BMI is 25.4. And what brings you into the clinic today?
Got a little bit of a sore throat.
Okay, and how long has the sore throat been going on?
About 2.5 days.
Okay, and how would you describe the pain in your throat?
Just kind of an achy discomfort.
Okay, and 0 is no pain, 10 is the most pain. What would you say your pain is today?
About a 6.
About a 6. And is there anything that has been making the throat feel better?
Just cold water.
Okay. And anything that makes it worse? Is it worse when you're like eating or talking?
No. I mean, when I swallow it hurts a little more.
Okay. And is it a constant pain or does it kind of come and go?
It's constant.
Okay. Well, we're going to be taking a look at your throat along with some other areas of the neck. So we'll see if there's, anything going on. We'll look into that. Okay. So I'm going to be doing a head-to-toe examination of your skin throughout. If there is any abnormalities, any lesions, anything to be noted, I will want to note the size of the lesion, the characteristic, the bed of the wound, if there is any open areas or lesions, as well as the surrounding skin around the area. But looking at your skin, everything appears to be uniform. Your color is pink. Would you mind if I just feel your face?
Go for it.
And your skin, I'm going to feel on your hands and your arms. So the texture of your skin is smooth, and your skin is warm and dry. I do not see any evidence of any jaundice, cyanosis, or pallor. And can I take a quick look at your hands, please? I like to take a look at the hands. So looking at your fingernails, they do look very well maintained. The nail beds are pink. I'm going to just press on both of your pointer fingers, and I'm looking for capillary refill to see the perfusion. It is less than 3 seconds, the pink returns. So everything looks good there. I'm looking at the nail beds. They're at a 160-degree angle. There is no clubbing, and everything looks symmetric, and I don't see any lesions or any abnormalities or dryness or open areas on your hands. You can relax. I'm going to take a look at the turgor. I'm going to just pinch a little bit of skin underneath your clavicle area and on the front of your palm. And your skin is elastic. If this was an elderly person, we would want to just do the clavicle to just check the turgor. So I'm going to go ahead and I'm going to inspect your scalp. I'm just going to feel your scalp. And I do not see any or feel any abnormalities. There's no lesions, no masses, no bumps. The scalp is firm. It is white. There is no flaky or any dandruff that I see. It is brown. The texture is smooth. A little bit of receding hairline, but other than that, no alopecia or any abnormalities there. His scalp also is warm to touch as well. I'm going to go ahead and I'm going to palpate your lymph nodes. I'm going to start with the occipital. I'm going to use both of my hands in a circular motion just to feel the back. And let me know if there's any pain or tenderness in any areas, okay? So this is the occipital, the postauricular, preauricular, tonsillar. Then we're going to do the submandibular, submental, and the anterior cervical. We're going to do the superficial and then again deep. And could you please put forward your shoulders? And the supraclavicular, and then the post-cervical. Any tenderness or any pain when I just palpated that?
No.
Okay, that's wonderful. So there is no, there's no enlarged lymph nodes that are noted. Everything seemed normal there. So I'm going to palpate your sinuses, the frontal, and the maxillary. Any pain or tenderness at all when I did that?
No.
I'm just going to percuss the frontal and the maxillary. And was there any pain or tenderness with that?
Nope.
All right, and now I'm going to just take a look at your temporomandibular joint, the TMJ, and I'm going to have you open and close your jaw for me a couple of times. And again. Okay, so there is no crepitus, there's no subluxation, no clicking, and everything seems equal and bilateral, symmetric on both sides, and good muscle, so the TMJ is intact. And I'm going to examine the ear structure now. And looking at the ears, I'm looking at both sides. The ears appear to be symmetric in size. I'm just going to have you turn to this size for me. And there is no evidence of any lesions, dryness, cracking, any bleeding here. I'm going to palpate the structures of your ear. Let me know if there's any pain or tenderness on any of these areas. So the tragus, the pinna, mastoid, any pain or tenderness there?
Nope.
Okay, and I'm going to take a quick look at this side. Any pain, any tenderness?
Nope.
Since there is no pain or tenderness, I am going to take my light source and I am going to examine the internal structures of the eye. I'm going to start, or the ear, sorry, and I will start on the right ear. And just taking a look, I'm going to pull a pinna up and back, and I'm looking in to the eardrum. The ear canal is pink and patent. There is cilia present. There is a small amount of cerumen, but it does not, I can still see past it. And the ear canal is pink patent. The handle of the malleus is present, and the light is at the 5 o'clock. And the eardrum, the tympanic membrane, is translucent, clear. There is no evidence of any drainage. There is no evidence of any bleeding, erythema, any issues on that side. I'm going to look into the left ear and do the same thing. I'm going to pull up and back the pinna. And same findings, but there are less, there's less cerumen in the left ear than the right, but the same findings normal with the tympanic membrane. I'm going to check the cranial nerve number 8. Which is the acoustic. I'm going to have you cover your left ear, please. And I'm going to whisper something in your ear, okay? It's cold outside.
It's cold outside.
Okay. And I'm going to have you cover your right ear, and I'm going to whisper something into your left ear.
Why won't the sun come out?
Okay, and then I'm going to do 2 more tests, the Weber and the Rhine test. I'm going to use this tuning fork here, and I'm going to strike the tuning fork, place it in the central portion of your head, and I want you to let me know if you feel it equal on both sides or if one is more than the other. This is the Weber test.
Equal.
Okay. So lateralization is noted. That is a normal finding. So that also shows that cranial nerve 8 is intact. Now I'm going to take the tuning fork, strike it, and put it right behind the back of your right ear. You let me know when you don't feel the vibration anymore, and then I will let you know when, and you tell me if you can still hear the noise, okay?
Mm-hmm. It's gone.
Can you still hear it? And I'm going to do that on the left ear.
Gone. Yep.
Okay, so air conduction is greater than bone conduction, so that means that the cranial nerve number 8 is intact. All right, now I'm going to look at I'm going to inspect the eyes. So looking at the eyes, could you take your glasses off for me for just a moment? Thank you so much.
Mm-hmm.
So looking at the eyes, I'm looking at both the right and the left pupils. They are a size 4 millimeters. They are equal and round. I am looking at the structures of the head. His head is normal cephalic. I'm looking at the eyebrows. They have equal distribution of hair and they are symmetric. Looking at the eyelids, the upper and the lower, they are everted, which is normal, and I'm just going to take a quick look and put down your eyelids here. The conjunctiva is pink. There are no lesions, any drainage, any issues there. The sclera is white. There is no redness or anything with the sclera. I'm going to come to this angle here, and I'm looking at the cornea. The cornea is clear. There is no signs of any arcus and no signs of any clouding. So now I'm going to take my light source, and I am going to have you look straight at me, and I'm going to shine my light into the right side of your eye, into your pupil. And with my right eye, I'm going to use the ophthalmoscope, and I'm just going to check for, okay, and the right eye constricts from a 4 millimeter to a 2 millimeter. And I'm going to look at the same in the left eye, and look right at me. And the left eye also constricted from a 4 millimeter to a 2 millimeter. That's checking cranial nerve number 2. I'm going to also be checking for consensual response. So I'm going to have you look straight into my face here. And I'm going to shine a light, but I'm going to be shining the light into the right eye, but looking for the consensual response on the left. Okay, and the left eye did constrict as well. And I'm going to do the same thing to shine a light on the left side and look at the right eye. And that constricted as well. So the consensual light and the direct light response were intact and symmetric and equal bilaterally. So the cranial nerve number 2 is intact. I'm also going to be doing a visual acuity test. And you wear glasses, correct?
Yes.
I'm going to have you put your glasses on for me. And I do have the eye chart here. I'm going to have you hold that chart about 14 inches away from you, which is a good distance right there. And are you able to read with both eyes the second smallest line here?
Yep. FELOPZD.
Wonderful. Can you read the bottom line?
DEFPOTEC.
Okay. So that is wonderful. You have 20/20 vision with corrective lenses. I'm going to go ahead and test for color blindness, and that was also testing for cranial nerve number 2, which is intact. I'm going to go ahead and I'm going to be testing for color blindness using the Ishihara chart. I am using one on the phone because we did not have one that was provided for us for this simulation. So I'm going to go ahead and ask you what number that you see.
6. 16. 2.
Okay, and no color blindness is noted, and I am going to put that phone back down on the table. I am going to have you take off your glasses for me. Sorry, there's a lot of on and off of the glasses.
That's okay.
And I'm going to have you take this. This is the cover-uncover test. I'm going to have you cover up your right eye, please. And I'm looking to see that your pupils are maintaining midline, or your midline eyes, and they're symmetric. can you remove that card for me? Okay, and both eyes maintained a midline position, and could you cover up your left eye for me? All right, and you can remove it, and both eyes remain midline. So now I'm going to have you cover up your left eye for me. And we're going to be checking accommodation, and I'm going to hold up a couple of fingers, and I want you to tell me how many fingers I'm holding up, okay?
1, 2, 3, 1.
And could you cover up your other eye for me?
3, 2, 1.
Okay. So that was intact bilaterally, and accommodation was met. So I'm going to have you, I'll take that from you, thank you so much. I'm going to have you, we're going to be testing for convergence. If you can look straight out to this window, the patio window, and I'm going to bring my finger up to your, perfect, up to your face. So both of his eyes both constricted and converged. So we were testing for the cranial nerve number 5. And then I'm going to have you look straight out for me to the patio, and then take a look at my finger and follow my finger to your nose. And that was another test of the convergence, which both of his eyes converged and were constricting towards my finger. And now I'm going to take a look at the internal structures, but first I'm going to do the light reflex test, the Hirschberg test. I'm going to flash a light with my light source to the bridge of his nose, and I'm going to be seeing if the reflection is equal and symmetric in both eyes. Okay, and there was a symmetric light in both eyes, so that would be cranial nerve number 5 is intact. And then I'm going to look into to identify the red reflex. For this, I have the ophthalmoscope on 0 because I do have 20/20 vision with my glasses. So I'm going to use for his right eye, I'm going to use my right eye to examine. And I'm going to first put that up to, okay, and I actually do see the optic fundus, or the red, and I'm going to go in and visualize the inner parts of his eye. And I was able to see in all 4 quadrants the arteries and veins. The veins are a little brighter than the arteries are. I did see the macula, which is darker, which is on the temporal aspect, and the optic disc is the nasal aspect, and the optic fundus is the orange glow. And I'm going to go ahead and I also did not see any notes of any hemorrhages, nicking, or cotton wool. I'm going to go ahead and use my left eye to assess the same on the left eye. And I do see the red light, the red reflex. I'm going to go into that internal structure. And I am able to visualize as well all 4 quadrants of that right eye. Again, no abnormalities, no nicking, hemorrhaging, any cotton wool. And I was able to see the optic fundus, and the same as the other eye. And now I'm going to inspect your nose. So looking at your nose, I am seeing that the bridge of your nose is midline. I do see a little bit of a scar midline, but other than that, I'm going to just take a quick feel. The skin on the nose is very pink and warm and dry. I'm going to have you cover your right nostril for me. And breathe in. And cover your left nostril. Breathe in. Okay. I'm going to have you close your eyes for me. And I'm going to have you tell me what you smell.
Garlic.
Okay, so it was indeed garlic. So we were testing for cranial nerve 1, which is intact. Now I'm going to take a look at the internal structures of the nose. Okay, I do see some cilia. I'm looking bilaterally. The turbinates are pink. There's no lesions, no drainage, no erythema, and I do not see any evidence of a deviated septum. I'm going to go ahead and I'm going to inspect parts of your mouth. Looking at your lips, they are symmetric. They're pink. They are a little bit dry, but it's winter, so it's kind of cold. I'm going to have you show me your teeth. All right. And your teeth are white. They're very well maintained. I don't see any evidence of any caries, lesions. Can I see your teeth again? And your gums look pink, healthy. There's no indication of any gingivitis or anything like that. I'm going to have you just test a couple other cranial nerves for me. I'm going to have you puff out your cheeks. And can you raise your eyebrows? And can you smile with no teeth? And frown. And smile with your teeth. All right, so the cranial nerve number 7 is intact, and there were bilateral symmetrics on both sides of the face, so that's cranial nerve number 7 is intact. I'm going to also check for cranial nerve number 5. And can you clench your jaw for me? Checking the motor aspect of this cranial nerve, the masseter muscle, there is no weakness on either side. It's the same bilaterally. There is a sensory component of this. Can I have you close your eyes for me? Mm-hmm. And can you tell me where you feel, I'm going to use a Q-tip. Can you tell me where you feel the sensation on your face?
Left eye. Left cheek. Right chin.
Okay. The temporal, maxillary, and the 3 dermatomes were all intact, so the sensory and the motor aspect of the cranial nerve was intact for that. So I'm going to go ahead and have you stick out your tongue. And looking at the tongue, it is pink. There is a little bit of white coating on it. I do see papillation. Can you move your tongue from side to side for me? Good. Can you put your tongue back in your mouth and push against my hand against the cheek? Very good. So cranial nerve number 12 is intact because the movements were midline and symmetric. And now I'm going to take a look at the back of your throat. And could you say ah for me? Ah. Okay. So the uvula was midline and rose and fell symmetrically. I can visualize the hard and the soft palates, which were both pink and moist. However, the area with the tonsils, they do look a little bit red and inflamed, but still the posterior pharynx is moist and pink. Looking at the tonsils, they do meet the pillars, so I'm going to give them a grade of a 2. There was no white patches that I could tell. However, I do see some crypts and some tonsil stones. So I'm not sure if you've had those before, but I do see those on the right tonsil. So I'm going to just have you open your mouth and stick out your tongue again. Good. And the uvula, like I said, rises and falls. Cranial nerves 9 and 10 are intact. I am going to put on some gloves for this next portion of the exam because I will be assessing your tongue. All right, so could you please open up your mouth? And I'm looking at the buccal mucosa on the side here. It's pink and moist. There's no lesions, no bleeding. And I'm looking at the parotid and the Stinson's duct at the second molar. They are intact. And then looking at the Wharton's duct here, perfect, you already had your tongue up. It is intact as well. So I'm just going to palpate the side of your cheek. Okay, there's no lesions, no issues. Can you stick your tongue all the way out? I'm going to take a look and run my finger down the sides. There are no lesions or any open areas, so that's all great there. Okay. And now I'm going to feel your temporal pulses. And it's a 2+, no cording. Any pain at all when I press there? Nope. I'm going to feel your carotid. 2+, bilaterally, there is a presence there. I'm going to auscultate and listen to your carotid pulses. And could you take a deep breath in? And hold it. And exhale. And then I'm going to go to the other side, and could you take a deep breath in and hold it? Good. There is no carotid bruits that are noted. I'm going to have you do some range of motion for me. Can you put your neck forward for me and look to the ground? And put your, oh, you can put your glasses on. I'm so sorry. We're all done with the eyes. And then could you move your neck backwards for me up to the sky, into a forward position to the left and to the right. And it appears that he has a good range of motion. Any pain or tenderness at all with that?
Nope.
Okay, so that is great. I'm going to palpate the cervical spine, sorry. And is there any pain or tenderness? I'm going to palpate the paravertebral muscles. Any pain or tenderness?
No.
All right, and I'm going to assess for the jugular vein distension. I do not see any signs of any flat or engorged veins here, and I'm looking at both sides. And I'm going to have you kind of tip your head back. We're going to make this work here. So I'm going to measure where I see the pulse here, the pulse tile, and I'm going to draw a perpendicular line here at the angle of Louis. I see that there's about 3 centimeters, and I'm going to add another 3 centimeters for the angle, for the accommodation of the angle of Louis. So that would be approximately 6 centimeters for the jugular vein pressure. Now I'm going to inspect. Normally we would do this in part of the assessment without a gown on, but for this purposes we're going to keep it on. And I'm going to just identify the landmarks of where I'm going to listen to your heart sounds. So the right second intercostal space is the aortic. The left second intercostal space is the pulmonic. Then Erb's point is the third. The fourth is the tricuspid. Over to the right fifth midclavicular line is the mitral. So I'm going to listen to all of those now with my stethoscope. Okay, and then I'm going to use the bell of my stethoscope and listen in all of those areas. And S1 and S2 are noted. There was no gallops, murmurs, rubs, or any extra heart sounds. I'm going to have you actually swing your legs over to this side here for me. I'm going to listen to the posterior part of your back, and all the skin looks good back here as well. Work of breathing is easy. I'm going to place my stethoscope on each area and just take a deep breath, please. Okay, and lungs are clear and no adventitious sounds, wheezes, crackles, anything noted. And that concludes our assessment. Thank you.